Students, today we explain structure of larynx. You know, larynx is known as voice box. Voice box is called larynx. Structure of larynx. At first, I draw the structure. This is the largest cartilage in larynx, and that name is thyroid. Thyroid cartilage present in this region. This is the pyramid shape structure, and this pyramid shape structure is arytenoid, and this is called cricoid. That means this is the three type of bones, and this arytenoid internally is broadened, and upper region of this arytenoid found a special elastic cartilage. That name is cartilage of Santorini. That means the name of this cartilage is thyroid. The name of this pyramid shape cartilage is arytenoid. The name of this end cartilage is cricoid. The name of internal cartilage in round shape formed in the two region is called cartilage of Santorini. Cartilage of Santorini is an elastic cartilage. You know, in the tissue, that cartilage is many types: white fibrous cartilage, hyaline cartilage, elastic cartilage, etc. And it is the elastic cartilage. And thyroid, cricoid, arytenoid, and this cartilage combinedly is a type of hyaline cartilage. Hyaline cartilage. That means thyroid, cricoid, and arytenoid is a type of cartilage is hyaline, and cartilage of Santorini is elastic cartilage. And the pore in the thyroid region is called glottis, and the upper part of this glottis found epiglottis. This is the structure of epiglottis. Epiglottis found in this region. Students, you remember that? Suppose the normal structure I explained with the help of simple paper. Suppose this is the structure of larynx. Frontal part is wider and lower part is narrower. This structure, upper part is known as thyroid, and the lower part is cricoid. And this is the broader part, but this is the narrower in comparison to this. That means the largest cartilage is thyroid and the smallest is the cricoid. And the back part of this larynx, that is the back region, there is the front region and the back region. Two arytenoid is present, and it is slightly pyramid shape. The pyramid shape arytenoid is present, and upper form of the arytenoid found two round shape lobe like structure, and that is called as cartilage of Santorini. That means four type of cartilage found in larynx. And what is the function of cartilage of Santorini? It helps to block the epiglottis. When you engulf food, you know, when engulf food, then food passes from pharynx and enter into esophagus. In that time, epiglottis have to block the glottis region or thyroid cartilage. That means in this time, epiglottis have to block, and the lower point of the round shape structure of cartilage of Santorini help to blocking the epiglottis. Suppose this cartilage of centrone is not present, then maybe this structure is very weak and they enter inside this region. In general, their work is when you have to inspiration, then it open and air enter inside, and when you expire and not also open, but when you take food, then it block this region. That means this region have to block, and food passes from this region to esophagus, not enter into the larynx or trachea. But if this structure is absent, cartilage of centrone is not present, then maybe it very weak and enter inside this. Like this is the block, and after that enter inside. Then food also enter inside when you take the food. So this cartilage of centrone is protect to enter inside in epiglottis, and epiglottis generally present and block this region, not in the banded form. So 4 type of cartilage present in larynx. 4 types of cartilage present in larynx. First, thyroid. This is the largest cartilage in larynx, and their number is only 1. Cricoid. It is smallest cartilage in larynx, and their number also 1. Arytenoid. It is pyramid shaped, and their number is 2. And cartilage of Santorini, their number also 2. So total number, if you count, then it found 6. That means the total number of cartilage in larynx is 6. But how many types of cartilage is present in larynx? That is 4 types. That means 2 type of questions. One is how many types of cartilage present in larynx? 4 type of cartilage present in larynx. What is the total number of cartilage in the region of larynx? The total number is 6. Okay. Now, in this region, it's most important. One vocal cord is connected in this region to in this region, and another vocal cord connect in this region to in this region. And these 2 vocal cord present in the region of larynx. And this one vocal cord is called true vocal cord, and another vocal cord is known as false vocal cord. This vocal cord is muscular structure, and they provide elasticity in the region of larynx, and cartilage also perform their normal function with the help of this cartilage. When we create sound, in that time true vocal cord is very important, because this vocal cord create the sound with the help of different cartilages and with the help of air. But false vocal cord also support, and false vocal cord is many type of reactive sound, like that not proper sound create. That means false vocal cord create to help proper sound creation, and true vocal cord normally create the sound. That means both the vocal cord when present, then sound is normal, and if false vocal cord have not present or non-functional, then sound is not create in proper way. So this is the vocal cord and their function, and lower region of this part found trachea, and trachea is the another part of respiratory path. So explain the trachea. Now we explain the another part of respiratory path, that is the structure of trachea and lungs. You know, the lower part of larynx found trachea. This is the trachea, and trachea divided into right and left two path, and that is called primary bronchial, etc. And trachea is formed with the help of C-shaped cartilage. That is C-shaped cartilage. It is one C and it is another C, that is in the combined form of two C form the tracheal region. And you know, the C-shaped cartilage is hyaline cartilage. That means hyaline cartilage present in this region. So that is C-shaped cartilage. In the back part, this cartilage has to join, and front part is open. That means in our, this is the trachea, and this tracheal part, that is the back part of the C-shaped cartilage is joined and front part is open. So this is called the trachea. And trachea in adult human body, the trachea, the normal length is 12 to 13 centimeter. The length of trachea in adult body is 12 to 13 centimeter, and the number of C-shaped cartilage, the number of C-shaped cartilage is near about 16 to 20. That means approx 16 or 18 or 20 always present, and this is the part of trachea. And upper part of trachea, you know, found the larynx, and I explain larynx. Now trachea main function is passes the air, and this air reach into lungs, and lungs alveoli have to participate in the exchange of gases, and this path is a vast way: primary bronchi, secondary bronchi, tertiary bronchi. I explain this topic in the another part. Now I explain the other part is the lungs. The lungs is bilayered, and lungs is generally two, left lung and right lung, and the lung is bilayered. That means this is the one membrane, and this is the another membrane of lungs. Here also two membrane present. This part of the outer membrane is called parietal pleura or parietal pleural membrane, and inner part is called visceral pleura. Visceral pleura, and these are combinedly known as pleural membrane. Pleural membrane. And this pleural membrane is bilayered. The outer layer is parietal layer, and inner layer is visceral. So this is the bilayered membrane, and in between this membrane found a specific liquid, and this liquid is called parietal liquid or parietal fluid. That means in between parietal pleura and visceral pleura found a fluid, and this fluid name is pleural fluid. This is the pleural fluid. At first I describe what is the function of pleural fluid. What is the function of pleural fluid. Student, this fluid is most important fluid. Suppose this is the lungs position, and when external jerk in this region, in the chest region, then this jerk not reach directly into heart, because heart not lungs, because this lungs is supported with the help of pleural fluid, and pleural fluid protect against this jerk, and this jerk have to normalize form. So pleural fluid, the main function is to protect against external jerk. Second, maintain normal viscosity and function in lungs. And third, separate two layers, that is parietal and visceral layer or membrane is separated with the help of this fluid, then the lungs function is normal way. And fourth, also protect against pathogen. That means, student, the pleural fluid is a specific fluid in lungs, and this fluid protect lungs from external jerk, maintain normal viscosity, that means their viscous nature is to maintain, and functions of the lungs also maintain, separate two layer, parietal pleura and visceral pleura, they are separated with the help of this fluid, so lungs structure maintain itself and protect against pathogen. So this is the main function of this fluid. Now, what is the difference between right lung and left lung? Right lung and left lung. At first, you focus, this is the right lung, because this lung is larger, and this is the left lung. This is the left lung. स्टूडेंट्स, जब आप बोर्ड की तरफ खड़े होते हो तो डायग्रामेटिक फॉर्म में हम देखते हैं कि ये जो पार्ट है ये लेफ्ट साइड है और ये जो पार्ट है राइट साइड है, तो सो इट राइट डाउन एंड इट इज द लेफ्ट लंग. लेफ्ट लंग की आकार अगर हम देखें तो ये छोटा है, राइट लंग का देखें तो ये बड़ा है. दूसरी बात, राइट लंग में 3 लोब पाए जाते हैं, 1, 2 एंड 3, जबकि लेफ्ट जो लंग होते हैं उसमें सिर्फ 2 ही लोब पाए जाते हैं, 1 और 1, 2. दूसरी बात करें तो इसका वजन अधिक है इसके तुलना में. एक वयस्क मनुष्य में इसका वजन लगभग 625 एंड इसका 575 ग्राम होता है. एंड दिस इज द लोब, एंड दिस लोब इज नोन एज सुपेरियर लोब. सुपेरियर लोब. This is called as middle lobe, middle lobe, and this is called as inferior lobe, inferior lobe, A, B and C. That means in the right lung formed with the help of 3 lobes, superior lobe, middle lobe and inferior lobe, and right 3 but left is 2, that is called superior lobe and inferior lobe. So what is the difference? One by one we explain and write down. At first, the right lung is larger in comparison to left lung. Left lung is smaller. Second point, the weight of right lung in adult human is near about 625 gram. It approx weight, and its weight is near about 575 gram. Third point, Right lung formed with the help of 3 lobes and left lung is formed with the help of 2 lobes. That means this is 1, 2 and 3. 3 lobes present in right lung and 1 and 2, 2 lobes present in left lung. In this diagram, when you focus, then you understand the left lung found a notch, a depressed part. This depressed part of notch is called cardiac notch, and cardiac notch present in this area. So, fourth point here in the right side, cardiac notch absent. That means in right lung cardiac notch is absent, but in left lung cardiac notch is present. That means cardiac notch present in left lung. Another point, this mid part is called as mediastinum region, and in this region present heart. So it is an area septing heart. Heart situated in between 2 lungs. Right lung is heavier and larger in comparison to left lung, and heart is also triangular form and shifted into the left side. So heart shifted to the left side and found in the left side of your chest, and right lung is larger, so it pushed heart, so heart shifted in this region. So in between 2 lungs present the heart. Sometime, some exception cases, maybe heart shifted into the right side. If heart shifted into the right side, it's not problem. It is a mechanical and physiological activities is normal, but it only the morphological problems, and this problem is called dextrocardia. That means if any person heart shifted into the right side, in case of the shifting in this form, the left to right, then it called the dextrocardia. Normal physiological function, mechanical function also normal. And in between these 2 lungs present a muscular structure, and this muscular structure is called diaphragm. Diaphragm is very important for breathing, and diaphragm directly controlled by our inspiration and our expiration, because all that activity is directly or indirectly depend upon the function of diaphragm, and diaphragm function directly with some hormonal activity that is called pineal hormone, and they control the activity of the diaphragm and their function. So human lungs is 2. Both lungs are interconnected. You have 2 kidneys, and some person 1 kidney not proper function, or suppose kidney fail, in that time 1 kidney may be transplanted and it possible to life save. But in case of transplantation in lungs, is possible or not? Yes, transplantation of lungs also possible, but both the lungs transplant in the same time. Heart transplantation is possible because in critical condition, if patients die with the help of some type of ventilation, and if separate the ventilation, patient not survive their life. So heart also possible to transplant in that case. Same type, in that case lungs also possible, one person to another person. So if any person is very critical and door to die, in that time that is possible to transplantation of the lungs. So lungs, if transplant both the lungs in transplant in the same time, and this part also divided into many branches, and these branches I explain separately.